Now, coming to the articulation of the elbow joint. The elbow joint is formed at the junction of three bones, humerus, radius, and ulna. To study the details of these three bones, you can watch separate lectures on sqadia.com. So, three joints are formed by these bones that are collectively known as elbow joint. These joints are humeroulnar joint, humeroradial joint, and radioulnar joint. Always remember that the lower end of the humerus is articulating with both radius and ulna. So firstly, talking about the humeroulnar joint, which is a pivot type of synovial joint. On the anterior view, a pulley-like trochlea of the humerus articulates with the trochlear notch of the ulna. Now posteriorly, the olecranon fossa fixes to the olecranon process of the ulna. We have a trochlear notch and olecranon process of ulna, which articulates with trochlea and olecranon fossa of humerus. Radius is the smaller bone of the forearm. The concavity on its head articulates with the capitulum of humeral condyle, forming the humeroradial joint. Present between the radius and ulna, we have radioulnar joint. The head of radius fixes to the head of ulna. Remember, we have two radioulnar joints, the proximal radioulnar joint and the distal radioulnar joint. But only the proximal radioulnar joint is involved in the formation of elbow joint. Now moving on to the types of joint. Humeroulnar joint, which is a hinged type of synovial joint, humeroradial joint, which is a ball and socket hinge joint, and radioulnar joint, which is a pivot joint. Let's look at the structure present between these bones, which is the articular cartilage. The articular cartilage is also known as the hyaline cartilage. It is a thin, tough, flexible, and slippery surface, which acts as a shock absorber and cushion so that the bones doesn't collide with each other, and is lubricated by synovial fluid, which enables the smooth movement of the elbow joint. Now let's make it easier for you to remember the articulation of the elbow joint with a mnemonic. Well, the mnemonic is crazy tulips. The C denotes capitulum, which articulates with the R, which is radius. And the T denotes trochlea of humerus, which articulates with ulna. See, it's a complex joint, isn't it? But I hope I made it easier for you with the mnemonics and everything. Well, now moving on to the ligaments that provides the support and stability to the joint.